where we will discuss strategies, lessons learned, and best practices from our expert panel today, which I'm very excited to introduce you to. Some of the objectives that you can look forward to is number one, again, we're learning firsthand from higher ed professionals who have actively leveraged grant funding to enhance behavioral health and mental health services for college students and their impact addressing mental health on their campuses. So different tips will be shared, best practices will be shared, and our hope at the end of this session is that you'll have the inspiration and information to determine how you're going to pursue grant funding to address the state of student mental health wherever you are, as far as the institutions or communities that you represent. Now, my name is Abraham Scully. For those of you who do not know who I am the founder and CEO of Speaks to Inspire, who is hosting today's webinar. We are a consulting agency that organizes affordable, high quality, and engaging mental health events. And it is my pleasure to welcome you to today's event. As I mentioned, it will be recorded today, so please note that and make any adjustments as necessary. I'm going to introduce our speakers in just a moment, but a few housekeeping. If you're not familiar with how to share responses in the chat, there is a chat box and you can share any messages either privately to me if you have any messages, or you can share them with the group just by selecting that chat button on your screen. We will be receiving questions. We may not be able to get to specific questions that you have for our panelists today, but we will be receiving questions that we can address during later events and webinars like this one. So we will have a specific Google form that we'll share in the chat when we get time to receiving any questions that you may have for today's session. The other thing, at the end of the session, we'll have a brief survey form for you to give your feedback for this webinar and share insight as to whether it was helpful or not, or any adjustments that you'd like to see in future events. With that said, I will now introduce today's speakers. Our first speaker, Melanie Ganezda Gilson. She's a licensed mental health counselor who has worked as a mental health therapist and an academic advisor, and she currently serves as the manager of student services with Seahawk Outreach Services at Broward College. She received her bachelor's in science and psychology from Stetson University and her master of science in mental health counseling from Nova Southeastern University. Currently at Broward College, she is the project director of the GLS Campus Suicide Prevention Grant, which actually ends this September. And she also sits on the Broward Coalition for Suicide Prevention and the Resource Working Group. So if you don't mind, give me a warm welcome in the chat to Melanie Ganezda Gilson. Our next speaker is going to be Dr. Lindsay Listow. She serves as the Executive Director of Institutional Equity and Student Conduct at Pensacola State College. In this role, Dr. Listow oversees student conduct, institutional equity, discrimination complaints, Title IX, case management, wellness services, counseling services, relationship violence prevention, the Pirates Care Team, and basic needs support. Over the last 3 years, Dr. Listow has received and managed over $1.8 million in grants to create and enhance student support services on campus. Dr. Listow has experience working in residence life, fraternity and sorority life, new student orientation, and student activities. Dr. Listow also serves as an adjunct faculty member in the University of West Florida College Student Affairs Administration Program. And she received her BA from the University of Tennessee, her master's from Virginia Tech, and her EDD from the University of South Alabama. With that, please help me give a warm welcome to Dr. Listow. So we are going to now invite Melanie and Dr. Lindsay to come off of mute. And before we dive into our list of questions that we have here, I'd like to give an opportunity to both Melanie and Lindsay to share a little bit about yourself. And I'd love to hear maybe the motivation that your institution had around seeking any grant funding. So Melanie, we'll start with you.
Thank you. Thank you for having me, Abraham, and welcome everybody. So my name is Melanie. I am a licensed mental health counselor and the manager of our Seahawk Outreach Services. And a little bit about that department is that we help with the non-academic support. So a lot of what Dr. Lindsay does, we do as well with the basic needs support. We help coordinate resources for our students so that they can try to stay in school. And having my background in mental health, as well as being an academic advisor for 8.5 years, those two positions we married together to be able to, move forward with this project, which we called Project Lifeline at Broward College. And the motivation for our team, our grants team, to seek out the GLS Suicide Prevention Grant has a few different tiers to it. The main thing was, here in Broward County, we experienced the Parkland massacre, the MSD shooting, and a lot of those high school students came to us instead of went away to school because of the trauma they experienced. And so we wanted to be able to figure out how we could support them, as well as our community surrounding Parkland. We had a lot of individuals who were affected in one way or another. And so at that time, we looked at research and it showed that suicide was the third leading cause of death in ages 15 to 34. So we really wanted to make sure that Broward College was equipped to support our community who would come to us for, to better their education, and that we would make sure we could support them. And that, coupled with the pandemic, we really saw a need to enhance and support our mental health, our students' mental health much better.
Thank you for sharing, Melanie. Dr. Lindsay, if you don't mind introducing yourself briefly and then sharing a little bit about the motivation behind pursuing grant funding.
Sure. Well, I'm so excited to be here with you all today and to talk about these amazing opportunities to help serve our students and help with mental health and well-being. I have been at Pensacola State for about 9.5 years now, and I have seen us really kind of grow and expand in terms of the services that we're able to provide our students. So like Melanie was saying, we really also look at what are all of those other needs that our students have outside of the classroom, and what can we do to support our students and help them remain academically successful and not have to worry about everything else that's on their plate and that they're doing. Pensacola State has actually received the GLS grant twice. So we first received it back in 2012, and then we received it again in the beginning of 2020. When we first got it back in 2012, really our motivation was that we had nothing in place. There was no campus care team. There was no training around mental health and well-being and suicide prevention. We had no protocols, no procedures, and we had several student deaths. And so thinking about what is it that we need to have in place and how could we bring that to our campus, make our campus more aware of mental health issues, get folks trained, how do we kind of set up the foundation for the work that we're going to do? And so that's really what 2012 focused on, was one, bringing awareness to our campus of mental health issues, and then getting protocols and policies in place for how to handle student crises when they happen. And that's where our care team came from. And then in 2020, we got the grant right before the pandemic. So you can imagine how things might have changed when the pandemic happened with the grant. But really, when we got it for the second time, we were looking at building on those foundational elements. And that was actually when we were able to bring on a full-time mental health counselor to our campus, was through our second wave of the grant. And that was really what the focus was on, was providing those direct client services on campus and then expanding our training and our reach. So it's been really interesting to see kind of how we've evolved having the grant twice and the way we were able to lay the foundation. And now we have this amazing resource center for our student that really has come out of the GLS grant.
Wow. So my mind is going now because I'm excited because there are a lot of either colleges, universities, or organizations that can use those resources to start something that isn't in place currently for student support around mental health and well-being. So to hear, what the grant funding has created for Pensacola State College, and as you mentioned, Melanie, for Broward College, it's hopeful because things like this can, create systems and opportunities and resources to help student mental health and well-being. So as I mentioned, we will have an opportunity to collect your questions. We're going to share in the chat box right now the link that you would use to submit any questions that you have, and we'll save those. And if we have time at the end, we'll kind of go through those if we have a moment to. But to go into our first question for our panelists, I'm going to come back over to you, Melanie, and I'd love for you to share in your role within the GLS Campus Suicide Prevention Grant, how did you identify the mental health needs of your campus community, and what insights did you gather?
So right before the pandemic, but right before we went remote, I mean, I'm talking like 2 weeks before, we were on the ground, pounding the pavement, going to classes and handing out a climate survey. And this was something that we received from our AVP of Student Achievement Initiatives. And so we saw in the results of that climate survey that mental health challenges were was one of the top three reasons why students would stop out in our student population. And so that was shared with our grants team, as well as data in the area that I mentioned about the age group and the time frame of stuff that has happened around our area. And the motivation behind it was we needed to beef up our infrastructure. We have 35,000 students, and we only had 2 therapists, and we saw that there was a challenge with access. Our students were having difficulty making an appointment, and they would have to wait 2-3 weeks to see the counselor or therapist, and that was unacceptable. And we have not enough staff for so many of our students, right? And some of the other things that motivated us were the lack of funding around being able to have more of an access to that mental health service, and to break down the barriers of the stigma around it and the help seeking behaviors that we were seeing. We saw that only a small percentage of our students were using the support. So we needed funding in helping us figure out how can we attract more students? How can we reduce the stigma around mental health counseling? How can we improve the access and the usage? And we wanted to also improve our support in the community. And so those were some of the motivations. So we worked on expanding our existing network by having MOUs. We have a training program in place. We're improving our outreach, and there's a culture change at the college now, where marketing does their own mental health awareness messages now for periodic, months like Mental Health Awareness Month or those sort of things, and they constantly are promoting our student counseling program and our website that we created because of the grant.
That's awesome. So you say climate survey, and my first thought is, what questions do you even ask? Because I would assume that if you're pursuing grant funding, you want to be able to have a clear understanding of what the climate is like, what the needs are, to be able to then develop some sort of proposal that actually meets the needs versus thinking that we know what the problem is, and then developing a potential solution for what we think the problem is. So if you can remember, or if you can share maybe one or two questions, or if not questions, then what can individuals be thinking about as it relates to maybe developing a climate survey for themselves or utilizing some sort of platform that exists. But can you share any insight as far as what's in that climate survey and what are we looking for? What type of questions are we asking? How are we able to get the specific responses that we're looking for?
Yes, from what I remember, and this was a few years ago now, the goal of the climate survey was to see what, like you said, what the students wanted. It had class modalities on it. It had everything that really brought you to the goal of how do we support our students through onboarding and through graduation. And the glaring fact that mental health concerns and challenges were in the top three really motivated the grants team and the AVP of Student Achievement Initiatives to reach out and work towards improving those services. But other things in there were class modality, and the basic needs, transportation, food insecurities, housing insecurities. A lot of those non-academic challenges were in there in that climate survey. And so we also were able to get grants from Florida Blue to open up pantries, food pantries on each of our major campuses. And we reached out for grant support for TRIO SSS, and we have 6 programs for TRIO student services. And so with the suicide prevention grant, I collaborate with all of those programs, all of those resources as well. So as a holistic approach, the climate survey should reach out and try to find out what's going to keep that student stable and be able to concentrate and continue and graduate to, to have that ultimate goal of getting the career that they are, reaching for.
Awesome. Thank you. So a holistic, comprehensive approach, because as we know, many aspects of a young person's life is impacted when we talk about mental health. So being able to look at it from that perspective, I think is very important. Thanks for sharing. Lindsay, I'm going to come over to you to talk a little bit about the application process. I know you said Pensacola State College receiving the GLS Campus Suicide Prevention Grant twice. As it relates to the process of applying, can you share any insight from your experience?
Yeah, so I find that no matter what grant you're applying for, whether it's the GLS grant or a different federal grant or even, a state or a local grant, really having a good understanding of what the grant provider is looking for. So really reading through the solicitation and making sure that you are hitting everything that they are saying is required for the grant. So sometimes I'll just kind of create a little checklist to make sure I know what is being asked of us if we're going to do this grant. It's also really good to kind of assess, do you have the capacity to implement this grant? And do you have the capacity to meet the requirements of the grant? And so that may take making sure you've got kind of a coalition on board to help you with the work when it's going to happen. And so a lot of times when we are doing grants like the GLS one, we look at who are our internal partners going to be. So what offices will we be collaborating with throughout the grant? And then what external organizations in our community do we need to have at the table as partners to make us be successful? So that's always a big part of our grant applications, is including who those internal and external partners are going to be. The other thing that I really highly recommend is making sure your narrative is really solid. So that's where you're going to talk about what you're actually going to do and implement with the grant. And being as specific as you can is really helpful. Melanie talked a little bit about kind of survey and data. I always make sure that in my grant applications, I'm including data when I have it. So one of the things that we actually were able to do with our most recent GLS grant was we joined the JED campus program, and through that program, we were able to do the Healthy Minds study with our campus. And so that study, the results of that gave us information about what was happening on our campus with mental health, and gave us statistics about how many students were dealing with depression, anxiety, but then it also gave us information about some of those basic needs support. It let us know how mental health was impacting students in the classroom. And so then we actually used that data to apply for other grants. And so whatever data you have, include it, because it paints the picture of what the need is on your campus. And then, like I said, just be really specific with kind of what you're actually planning on doing and making sure it's something that makes sense for your campus and then also aligns with what the grant provider is seeking.
That's really good insight, and specifically about capacity. Recognizing whether we have the capacity to execute this or not is important. And there's so many things that you just shared that I want to unpack, but I want to move on with the questions. Before I do that, though, if you were to say there are 3 essential steps, and I know this is probably hard, but 3, let's say I'll give you up to 5, 3 to 5 essential steps to consider or to check off of the checklist to determine whether this application is worth, this funding is worth applying for or not. What would be on that checklist regarding your experience and expertise pursuing grant funding, would you say, Lindsay?
Yeah, I think the first thing, what I already talked about, is reviewing the solicitation. So really having a good, solid understanding of what's being asked for in the grant, assessing your campus, having an understanding of your climate, of what you have already available, and what this could either give you the foundation for or what it could enhance. And then I would also say making sure you're building those partnerships and having collaborative conversations from the beginning. So whose support are you really going to need to implement the grant as well? So to me, those are the 3 biggest things. And then making sure you kind of have all the knowledge at the table when it comes to creating your budget, assessing everything. How are you going to measure the impacts that you're having? But those 3 are the biggest ones to get started with.
That's great. Now, coming back over to you in the same vein of implementation, Melanie, what did your institution implement after receiving grant funding to increase or strengthen behavioral health services, and especially around, reaching those who are at risk of suicide, depression, substance use disorders? I know you mentioned, or at least I think I heard you mention in your introduction, being able to hire staff, but what exactly was implemented after receiving grant funding that helped to increase or strengthen what was in place?
So we were able to increase the number of therapists that we have working with our students and add in a telehealth option for nights and weekends. And that was really important to us because something that we learned was our students are not generally the traditional college students. They're, working parents, students that are, living on their own independently and having challenges with the 9 to 5 time to see a therapist. So we added nights and weekends with a part-time therapist through our current student assistance program. So the grant is funding a part-time therapist. We have implemented several different trainings that our faculty and staff on site are qualified to do. One being the QPR, which is the question, persuade, and refer. We're pursuing another one as a possibility to continue the infrastructure, to build up the existing infrastructure for social connection, which is kind of like the bottleneck to opening up to all of the other challenges that an individual may have. And we have implemented several different workshops with SMEs in the area through experts that that I've met through my past jobs or through research or through connecting with Speaks to Inspire. And so we've had workshops come out, SMEs come out and do workshops on social media and mental health. test anxiety. We've had lived experience. We've had a lot of individuals like yourself. Abraham came out our first year and talked about his lived experience and challenging the stigma around mental health. And Abraham came out with and also spoke with some of our staff and helped teach them how to support their students. So along with Speaks to Inspire, we've had other vendors come out and do that for our faculty and staff. We've had several, individuals come out and do mindfulness workshops as well. So we've done self-care, we've done lived experience workshops, we've done experience with, like, these are the signs and symptoms of depression and anxiety. So educational, psychoeducational workshops. And so we're really working towards educating our students, faculty, and staff about those things, because then the more you understand, the less scared you are to talk about it. And so with the QPR, we talk about suicide. We're not going to be afraid of saying that word. With some of our psychoeducational, workshops, we talk about anxiety and depression, and we learn about what that looks like, and that so they can either have more self-awareness, or they can identify one of their peers that's struggling. We're promoting on all of our screens the 988 number, so everybody knows that that's available for them for crisis intervention. And we tell them that they don't have to be suicidal. They could be, they could be at the point where they're just struggling so hard they don't know who to talk to. They want anonymity, so they can text, they can chat. Just reaching out for help is okay. Whatever you can do, just ask for help. So those are some of the programming things that we've done. We've done it through social media. We've done it through tabling events. And we actually this week just had our Fresh Check Days. So that's through the Jordan Parko Foundation, where we were able to have fun, interactive booths with mental health themed activities. And one of the ones that I really liked that I wanted to highlight was there you had 4 buckets of like with a little bit of water in it, probably about a third of water, and you had ping pong balls, and the students wrote their challenges on the ping pong balls, the ones that were manning the table, and the participants would pick a ping pong ball and say it was their English professor, or say it was work, or say it was school, whatever the case may be. They would have to hold that ping pong ball down into the water, and the attendees of the booth would be throwing more problems at you, and you would have to try to gather up all those ping pong balls with one hand and hold them underwater. And it was a realization and self-awareness in a fun way to know you're going to have things thrown at you, and you can't just do it with one hand. So you either need to ask for help, or you need to say, I have to say no to all of these obligations, or to this family member that's toxic, or to this situation that's going to overload me. And so those are kind of some of the things that we're trying to implement in the culture and in the practices. And Student Life participated, and my department participated in peer mentoring. So we get a collaboration, like Dr. Listow was saying. We have to collaborate with the people, with the groups that are going to bring the students, or you're not going to get a good turnout.
Awesome. And one thing I really appreciated in being able to work with you, Melanie, in Broward College is it was very clear that there was a strategic approach to reach your student population. So one thing I know about Broward College is majority of students who attend are non-traditional college students who are working jobs, their parents, they're doing different things. And so the programming needs to be tailored toward that population versus a college or university who does have a large majority of traditional college students who maybe are staying on campus, who are only going to school. So I think that is important when it comes to developing proposals and thinking about programming is, hey, maybe we shouldn't do an event at 12 p.m., but we can do it in the evening when they're off work and can actually attend. So thank you for sharing that, Melanie. So Lindsay, I'd love to hear from you any specific initiatives or interventions that was implemented through the grant that you think and have seen that has made the most impact on student well-being? I'm sure there are tons of different programs and initiatives that has been executed, but any one of those interventions or initiatives stand out as far as it having the most impact?
Yeah, so for us, I would definitely say with the second round of funding, being able to use the funds to hire full-time staff and provide the direct client service. So we, like I said, did not have counselors on campus before we had the grant. And so that allowed us to have a full-time professional who could meet with our students who needed counseling, develop relationships more with our faculty and staff to support them and really help us as we continue to change the culture on campus. And so I think that was really our big initiative and our big push with the second round of funding, was to have those services and then to create the culture like Melanie talked about, where students felt okay coming and getting help and asking for help. And so we did a lot to be really out in the community and meet students where they were, rather than having the students try to come find us, just so they would be aware of the resources that were available to them. And then we also have a non-traditional student population. So our counseling staff did also kind of adjust their hours a little bit to offer some evening hours as needed. So I think just looking at, again, the needs of your population and figuring out how can you develop initiatives that are going to be impactful and meet your students where they are.
Now, I guess this is a follow-up question for you, Lindsay. As far as impact, what that means, how that's measured, what does that look like when we're talking about this grant?
Yeah, absolutely. So for us, what it looked like was we would survey our students every semester to find out kind of where they were when they started services with us, and then where they felt they were at the end of the semester. So we were kind of looking at, are the students flourishing more? Are they, have they reduced their suicidal ideation? So we actually, for our counseling, we use a software called Titanium. And we work with the Center for Collegiate Mental Health to use their, it's called a CCAPS. So it's an assessment that students do before they come and see our counselors. And then we can have them redo it at different points during their treatment. And so we're able to kind of see their scores on that and then look at, did suicidal ideation go down as a result of counseling? Did some of these well-being areas increase because of the counseling? So that was one way we looked at kind of impact, was we looked at it with kind of individual clients and how they were doing. And then the other thing we did was we looked at of the students that are receiving services, that are participating in the trainings that we're doing, that are participating in the outreach activities, how many of them are returning to our campus and how many of them are graduating? And then we could look at, our retention numbers, our impact on our tuition dollars because those students were coming back, our impact on those students graduating. So those were the different kind of measurements that we use. So one, again, those individual clients, kind of what were their growths. We did the same with trainings that we did. So we do pre and post tests with every mental health training, so that we could see kind of learning that happened during those trainings. And then we looked at, were students actually retained and did they graduate? And our counseling numbers tend to be in the high 80% each semester. So we know that we're making a difference compared to what our retention rates are kind of overall as an institution.
Thank you for sharing. And it was mentioned earlier, the Healthy Mind Study, and at Speaks to Inspire, we've worked with multiple institutions who have done the Healthy Mind Study, and we've only heard great responses as far as being able to identify where the students are, what their needs are, be able to have that data and utilize it for the direction that they'd like to take the campus around mental health and well-being. I think the other tool that's worth mentioning is with the Healthy Minds Network, they developed an ROI calculator, so a return on investment calculator, where institutions can input certain data about the institution and be able to have a tool that shows the return on investment when mental health resources, interventions, and programs are implemented, which also helps as far as seeking grant funding, getting buy-in within the institution as well, and having a better understanding as far as how does this resource, this initiative or intervention, how does it help the institution overall? So I think those are really good tools that are worth looking into for those who are attending. All right, so I have another question. Melanie, you talked about partnerships. You mentioned NAMI, and for those who are not aware, NAMI is the National Alliance on Mental Illness, and you mentioned being able to develop an MOU with your local NAMI chapter. Can you share any other examples of successful partnerships that has enhanced the effectiveness of your program?
Absolutely. So our second MOU that we have established is with with an agency called South Florida Wellness Network, and they're a non-clinical agency that helps with supporting individuals with mental health and substance abuse challenges. So they have individuals that are in maybe quarter-way houses or halfway houses that are looking for education. So we connect them with our grant-funded programs so that they can improve their um, working, their career or a new career with a certificate. Do psychoeducational training. So they do the WRAP training for us, which is Wellness Recovery Action Plan. And we've had our psychology club experience it, and it's really, really great. It's interactive, it's very detailed, it really gets you thinking. And so we hope to have more of those. And so that's our partnership. So we help their clients work towards an educational goal, whether it be a short certificate or any kind of support in that educational goal to help their careers. And they help us with mental health. They've also looked at, some of our students have signed up to also be peer support because they have a lot of peer support in that area. So our students who are interested in the field or have lived experiences can also get work experience through that. And that's the same thing with NAMI. They also are reaching out to get some of our students who are interested in being their peer support. With NAMI, I'm also going to help them work towards getting the QPR training through their grant that they're currently having. So we've invited them to some of our trainings that we have here. We may also facilitate some for them until they have everything settled and are ready to go. So those are our partnerships. We have NAMI's group flyers on our website so that our students are aware that they can attend free support groups, and they know of all of the free support that both of those agencies have to offer. So those were some of the partnerships. They also attend all of our mental health tabling events. So we have what we call mental health awareness festivals. And so NAMI is always there, South Florida Wellness is always there. We're constantly branching out and finding new community agencies to share with our individuals that that attend those tabling events, that share with our students. We have healing, I think it's called Art of Healing, I think it's called. There's an agency that does specifically with trauma. So we're going to have a Take Back the Night event. So we're going to have our sexual assault treatment center there. We're going to have the trauma therapy center there, women in distress. We always have our student assistant program table at our events. So, and like Lindsay was saying, we want to meet our students where they are. So we are constantly in the community showing them that all of those resources that are available. My department, Seahawk Outreach Services, will also table so that they know that we have those non-academic supports as well. And so we've branched out with different areas. So our South Campus has a specific, type of agencies that are close in vicinity to their area. Same with our Central and our North. So we'll try to make sure that we have that agency there for those events as well. So those are some of the things we've done. We're looking for the third and final MOU that was required by the grant. to finalize. So I have a few contenders that will hopefully give us the same, that we can give them support and they can give us the psychoeducation really is the main thing, because that is going to help us also continue the infrastructure of the trainings that we want to continue to have, and so that it continues to infuse into our culture here at Broward College.
Awesome. Thank you, Melanie. And Dr. Lindsay, I actually have the same question for you as far as successful partnerships. What has been established around partnerships that has enhanced the effectiveness of the program?
Yeah, that's such a great question. So for us, we have had some local partnerships. So again, we really connected with some different community organizations. We've also worked with our local NAMI chapter as well. We in our county also have the Escarosa Suicide Prevention Coalition, which actually was kind of built out of our very first GLS grant coming to Pensacola. So we've worked with that group as well. We also have a mental health task force in our area. So we've been able to sit on that task force and help look at kind of what's happening in our county as a whole, to support mental health and well-being. And then just different partners, some of our crisis centers in the area. We don't offer any kind of psychiatry on campus or through any of our programs. So we actually partnered with a local nonprofit who does medical treatment. And so they were able to provide psychiatry services to our students. And then we provided the counseling services. So we talked to one another and were able to get releases to be able to share information back and forth to support our students. And then in terms of kind of larger entities, like I shared earlier, we did become part of the JED campus program as part of our grant. And that was incredibly helpful for us to kind of assess where we were and assess what our needs were, and then walk through with experts kind of what we could do and bring together this kind of cross-campus collaborative team to implement all of the different initiatives that we were doing. The Healthy Mind Study, we've worked with our Active Minds chapter. We've worked with Speaks to Inspire. We did a speaker series. It was fantastic and really kind of well received by our faculty, staff, and students about different mental health topics. And then we also introduced peer support. We use Project Connect. And so we're able to develop these small groups for our students that are based on affinities, and they can come together and have that peer support as well. So those were all really strong partnerships that came out of the grant, several of which we are able to continue and sustain after the grant ended.
Awesome. I think that's super important, sustainability, right? And long after this grant is gone, we'd like to be able to have the infrastructure that was developed because of the grant funding that is able to continue the work. I wanna stay here a little bit. I'm looking at the time and I have a few other questions. So I guess let's do like a rapid fire, because I have a follow-up question for both you, Lindsay, and Melanie around partnerships. Now, when you're looking at different organizations or entities, whether it is on a smaller scale, doing specific things, or on a bigger scale, doing certain things towards the grant objectives, how do you know whether the partnership is a good fit or not? And what does that conversation look like to determine what the college is providing and what the organization is providing and how it's mutually beneficial? Can you share? I want to keep it brief because I do have a couple of other questions, but if you were to share maybe one or two things to help you determine whether you move forward with this partnership or not, what are some things to consider? I'll start with you, Melanie, and then come back to Lindsay.
So I could speak from my experience. I looked at the agencies that had several different opportunities for students to access, and that the access was free for our community, and that we as a college didn't have to enter into any kind of fee exchange as well, because that wasn't part of the grant. It wasn't in the budget. So the cost and it was number one. And the access, do they have several different sites? So for instance, South Florida Wellness Network has 3 different locations. They have several different programs. And we, we support our students that are experiencing housing insecurities as well. So if they wanted to come to the college, they would not have to pay for tuition if they were living in their extended care housing. If they were in kind of in between with their quarter-way houses or halfway houses. So that was, that was something that I saw as a plus. It would help our enrollment. It would help those students thrive, and then we would have that psychoeducational component that they can offer. And so those were some of the things that I looked at in terms of what we would need and what they would need from us. And the conversation was, who do I talk to? Who's the one that's going to make the decisions? How do I get to that person? I probably have to go through sometimes one or two people, maybe 3 or 4 to get to the right person. We set up that meeting. We talk about what we need. They tell us what they would need, and then I would get it reviewed through legal. We would have to go through a process to make sure everybody's on the same page and everybody and the authorized signers are up for it, and then we would move forward with it. So those were, so you have to think about the process, who has to be involved, who are the stakeholders, and what are going to be the highlights that are going to be easy to access.
I think I would just add, start by looking at who your current partners are. So we've been really lucky that we have kind of always relied on our community. So we didn't have to seek a lot of new partnerships, but it was conversations around, does this organization make sense in terms of their capacity to assist us? Do their missions and their services align with the work that we are trying to do through our grant? And then a lot of times, to be honest with you, it was more beneficial for us than for the organization for us to be partners.
Sometimes.
Yeah. But we were really lucky that those organizations were willing to work with us.
Awesome. Thank you for sharing. So let's talk about, we talked about some of the great things, the programs that have been put in place and the resources it has provided to students and all of this great stuff. Now I want to get to the challenges. What were some of the things that you thought this was going to, go extremely well and it went south? But as far as anything that you are comfortable sharing and can think of, what were some of the challenges that you faced and your institution faced, after being funded and now, in the implementation of this grant funding? Like, what were some of those challenges? And then what were some of the ways that you addressed some of these challenges that came up? Dr. Lindsay, you want to start us off?
Yeah, sure. So I would say we were kind of unique with our second go around because we literally received the funding 2 months before the pandemic hit. So that was a huge challenge for us in terms of having to rethink how we were going to be doing everything that the grant had asked us to do. So that was probably our largest challenge. And then trying to re-engage faculty, staff, and students around these topics of mental health and well-being when they are literally in crisis mode. So how do you serve your community? How do you make sure you're doing what the grant says you're doing while essentially operating in a crisis? And so that I think was really challenging for us. I think the other part too was figuring out the planning stages. So you write this narrative, you say you're going to do all these things, but then when it comes time for implementation, it might take you longer than you expected to get somebody hired for the grant. It might take you longer to get some buy-in from different partners that you need. And so just kind of preparing for those roadblocks and knowing that it's okay if it takes you a little bit longer to get off the ground than maybe what you originally thought. And then I will share, one of the aspects of the GLS grant is that your institution has to match the dollars that SAMHSA is giving you. And so sometimes we had to kind of rethink things and figure out, okay, how are we matching these dollars? And so that's something that you definitely want to have a conversation with your grants office, your budget office, to figure out how are you going to be able to do this match? Because that is something that I think sometimes is a challenge for institutions.
Absolutely. Yeah. I can piggyback on some of the things, but we experienced similar challenges in terms of, so what I mentioned that we have the part-time therapists that we're hiring. We had to do an addendum to, to the contract because we were originally going to try to get a separate vendor, but then we didn't have enough funds for that because that wasn't written in the grant as terms of like maybe a 24/7 telehealth vendor, you know, because they're much more expensive than the in-person. Right. So we had to rethink that process. We had to go with our current student assistance program and have them hire somebody, and then we had to pay them. And that took much longer than expected, of like you mentioned. And one of the things that was good about the GLS suicide prevention grant is although we have to enter in our quarterly reports or in our data, we were given the first couple months grace period. We didn't have to enter in any numbers during that time, that we were planning and that we were trying to implement stuff and that we were trying to build up that momentum. So that was very helpful. One of the challenges that I think I experienced as a project director was the process of getting approval for things, right? So we have a state institution that requires several levels of approval for purchasing, for vendors, for risk management, for procurement, for all this stuff. And so I had to learn and navigate all of that as I was implementing the program. And so that sometimes was a challenge, but I collaborated and I met really great people from across the college. So that was something that was a really surprise, surprise, I guess you could say, like, benefit from it. Because not only am I collaborating with community members, I'm also collaborating with people across the college in different departments that you never see, that are always behind the scenes. And so that was really good. Getting the students to the events, that was a challenge. We were 1 year out of the pandemic and we were returning back to campus, but a lot of our students were still feeling the effects of that social isolation, the fear. We had to learn how to collaborate, and I worked with Speaks to Inspire for a few months in the beginning to try to combat those obstacles of how do we bring them to those events and how do we get them to participate, towards that opening up of the community again. And then accessing our veterans was a challenge for us, and still is, because we have Mission United down here, and so they all go to Mission United, and they don't share their mental health challenges with anyone but who they feel comfortable with, whether it be other veterans or whether it be Mission United. So those were some of the challenges that we experienced in implementing and spending money, which is supposed to be easy and which I love doing. It is also a challenge in terms of the process of approval and getting through and doing it in a timely manner.
Thank you for sharing. So I want to actually wrap it up with one final question, and then I am going to share that survey form for attendees to fill it out to share your feedback. We can actually share that in the chat now for you to access that. But as far as there being institutions that are represented today on this webinar, and some of the individuals, they are considering applying for this upcoming GLS grant. Maybe they're looking at other grant funding opportunities, but they're not sure whether they should pursue it. Maybe they've identified that the need is great and they do need those resources to implement these wonderful programs that both you, Melanie, and Dr. Lindsay have been able to develop through grant funding. What would you say to that individual who's representing an institution where they do have needs around supporting student mental health and behavioral health? What can you share as far as we wrap it up, things to either consider or maybe, I don't know, something inspirational? I don't know. It's as I hear like both of you guys' story and being able to work with you both, I've been able to see, wow, grant funding can really make a big difference when you have the resources to execute different programmatic efforts. But there are some either misconceptions and barriers that are in the way of even starting the application or doing the thing. So what can you share, Melanie? And then we'll come over to Dr. Lindsay.
So I would share that this has been the most amazing experience for me and my colleagues. We're all so invested in this process now that it kind of helped push us to do this global, public health kind of view of mental health challenges that our community is having, rather than look at it in a microscope of just our little community. I've learned so much about the nationwide data. I've gotten connected with people in Pennsylvania through the Higher Ed Suicide Prevention Coalition. The connections that you make with other professionals are so inspiring, like Abraham said, and it really taught me a lot about how I can implement and inspire our colleagues, faculty, staff, students to be mental health advocates. And that is something that I think is going to live on longer than any grant or any, position I have at the college, is that we are inspiring others to understand what's going on with others, be kind, be open to assisting them and being advocates for everyone, and looking at it as a global perspective of how we can improve the culture at our institution.
So I think I would say that even just considering applying for this grant tells me how much you and your institution cares about your students. Because you're seeing that there's a need, you're wanting to make things better, because that's a lot of times what these grants do. They enhance the services that we're able to provide our students and make things better for them. So I would kind of applaud you for even thinking of doing that. The second thing I would say is, don't be overwhelmed. It can sometimes seem like a lot, but if you have conversations up front, if you think of who those collaborative partners are going to be, if you get buy-in from your administration, it will end up not being an overwhelming task to apply or to implement the grant, because you've got those supporters with you. I'll also say this, I'll say don't give up. So if you don't get funded right away, that doesn't necessarily mean you won't get funded at some point. There may be other opportunities and other grants that you can apply for. Honestly, when we got our 2020 grant, we had applied in 2018 and we were not funded in 2018. And then instead of having a competition, they funded down in 2020. And so we were able to get funding later than we had originally anticipated it. And we said, absolutely, we will take it. We're so excited. We're going to run with this. And then I think that the biggest thing to leave with, and this really echoes what Melanie just shared, that these types of grants give us the opportunity to not only serve our students and help them be better mentally and from a well-being perspective, but they truly, truly help you change the culture of your institution. And I think that's been our biggest focus on all of our mental health and well-being grants, is how are we changing our culture to destigmatize asking for help and to really come across as we are an institution that has a culture of care for all of our students and all of our employees. And we've certainly seen a huge shift. So you can have little impacts and you can have giant impacts with these grants. So definitely pursue them if you're interested.
Thank you so much. And with that, I would love for everyone who is here to please say thank you and give a warm gratitude in the chat for Melanie Ganesta Gilson and Dr. Lindsay Listow for their time, insights, expertise, and successes and lessons learned. I think this is very impactful from a perspective of someone who has done it, who is doing it, and how it can be possible for an institution who is interested in starting that process or needs support while they're in the process. So thank you both for your time today. Thank you everyone for attending. Finally, I do want to share this so I forgot we had music. So rather than that, I am going to share the link in the chat for you all to complete this brief survey form, sharing your feedback if this webinar was helpful. And once you get that completed, I do want to also share that you will receive a follow-up after this webinar with any resources that can be supportive for you throughout your journey. If you are considering grant funding, I would also recommend that you connect with Melanie and Dr. Lindsay. I know they're both on LinkedIn, so I'm sure they would like to continue the conversation. I know they're both very busy, but I'm sure they'd like to entertain this conversation even after today. Again, thank you all so much. Please